Good afternoon, everyone. I want to say thank you for joining us. Today, I am joined by Dr. Kara Christ, Major General Mick McGuire, Damon Brown, the Regional President at Steward Healthcare, and Colonel Daryl Fust from the U.S. Army Corps of Engineers. We're also pleased to be joined by Anne Marie Almadian with the Arizona Hospital and Healthcare Association, Jennifer Carcetta with the Health System Alliance of Arizona, Robin Schaefer with the Arizona Nurses Association, Dr. Chris Laban, President of the Arizona Osteopath Medical Association, Dr. Richard Dubsrin from the Arizona Osteopathic Medical Association, and Ross Goldberg from the Arizona Medical Association. I want to begin by wishing Arizonans a happy Passover and an early happy Easter. Our prayers and hearts are with all of our citizens, and I'm so appreciative of your patience and cooperation during this very difficult time. As Arizona's fight against COVID-19 continues, our hospitals and healthcare workers are on the front lines. We've coordinated closely with Arizona's healthcare providers and medical executives, and we're pleased to have some of them with us today. Before we get to today's announcement, let's touch on a handful of actions Arizona has taken in the past 48 hours. Yesterday, my team teamed up with Secretary of State Katie Hobbs to allow Arizonans and notaries to sign and notarize documents online starting tomorrow. I'm grateful to Secretary Hobbs for her continued bipartisan partnership and leadership to get this reform in place as fast as possible. Also yesterday, Superintendent of Public Instruction, Kathy Hoffman, and I announced a mobile Hotspot donation drive so more Arizona students can get online and continue distance learning from home. To get things started, the state of Arizona has donated 200 mobile hotspots for students in our rural areas. And we're encouraging people, if you'd like to help our kids who are at home and would like to distance learn and can't, you can go to arizonatogether.org and make a donation there. Buy a hotspot that'll serve a family. In addition, we announced that Arizona has been awarded $10 million from the Department of Agriculture. These emergency assistance dollars will help make sure low-income families, individuals, and seniors have access to nutritional meals. And we're proud to announce that the USDA has approved Arizona's request to allow people on food stamps to purchase food online as soon as next month and to implement other needed changes. Now I want to touch on a real issue of concern in Arizona, and that's the Navajo Nation, which remains top of my mind. This morning I spoke with President Nez and the Vice President of Navajo Nation. Our teams are coordinating on a regular basis. The state of Arizona has committed to the Navajo Nation and will provide all the state and federal resources they need to fight COVID-19 and to protect their residents. National Guard personnel will remain on site in Tuba City. They will continue to quickly deliver PPE, supplies, and support the nation. I'm also coordinating with Governor Herbert in Utah and Governor Michelle Lujan Grisham in New Mexico. We all had a conference call earlier this week to coordinate, and they both pledged their support in working collaboratively to support Navajo Nation. Our hearts go out to the Navajo people, and our statewide plan is focused on protecting them. And that brings me to today's announcement. We're standing here in front of St. Luke's Medical Center, which closed its doors last November, less than 5 months ago. The world has drastically changed since then, as the needs of our healthcare system have as well. Today we are announcing that, with the leadership of the Department of Health Services and the U.S. Army Corps of Engineers, St. Luke's will be reopening its doors with 339 ICU high acuity beds, with flexibility to use this space for other needs as the situation on the ground unfolds. These beds will provide additional surge capacity for hospitals in Maricopa County, meaning if they need it, St. Luke's will relieve potential overflow that could come in the weeks ahead with additional beds for patients that need an ICU. We expect these beds to be available within 3 weeks, which coincides with Arizona's projected peak for hospitalizations from COVID-19. Construction is currently happening with the U.S. Army Corps of Engineers, and we'll hear more about that shortly from Major General Mick McGuire. I want to thank the Army Corps of Engineers for their quick action in getting surge capacity set up for our state if it is to be necessary. Our hope is that we never have to use these beds, that our physical distancing measures, travel restrictions, limitations on elective surgeries, and other protective actions will mean fewer infections and less strain on our healthcare system. But we've also learned what's happening around the globe, and specifically from New York State. And we in Arizona have had time to plan and prepare. So we're planning for a worst-case scenario. It's the responsible thing to do in this situation. And there's more to our plan. This is a statewide plan. In Coconino County, we've identified a site that will provide flexible bed capacity. In Pima County, we're finalizing our assessment of options to add additional bed capacity for critical and non-critical patients if needed in the coming weeks. Dr. Christ will provide more details. These actions coincide with our efforts to ensure that the state of Arizona is coordinating closely with medical providers to understand what needs we have and where those needs may be. This Tuesday, I signed an executive order to expand data gathering around COVID-19 so that Arizona can make the best possible data-driven decisions to increase hospital capacity and protect public health as necessary. The order requires additional reporting in areas such as the number of ventilators and ICU beds in use and how much PPP is being used per day along with current inventories. It comes in addition to previous orders enhancing data gathering and requiring hospitals to increase bed capacity, optimize staffing levels, and maximize critical resources. In addition, yesterday's Arizona Medicaid program, Access, announced more than $50 million in accelerated payments and advances to Arizona hospitals. They will also be extending an additional $5 million in funding to hospitals in rural areas. Earlier today, I signed an executive order that strengthens liability protections for healthcare professionals serving COVID-19 patients. Our intent with this reform is to boost the number of licensed healthcare professionals on the front lines. These are the professionals that will provide assistance at our existing hospitals and at sites like this. This includes any healthcare professionals who are currently retired but may be able to step in, volunteer, and help. Arizona's goal with all of these efforts is very clear: to be able to meet the demand for hospital beds and patient care wherever that is in our state or on the Navajo Nation. This model is one we can scale anywhere in the state as hotspots occur. And with that, I want to hand it over to Dr. Kara Christ for public health updates Then we'll hear more on this project at St. Luke's from Major General Mick McGuire. Dr. Christ?
Thank you, Governor, and good afternoon, everyone. Thank you for joining us today. As you know, over the last few months, we've been fully engaged in responding to COVID-19. And over the last few weeks, we've been working closely with the Army Corps of Engineers to gain additional capacity within our healthcare system in Arizona. We're developing a model that will be able to quickly scale up and meet the needs for Arizonans. This facility is a good example of this, providing additional bed capacity with flexibility for levels of care depending on our demand. As a physician who's worked in the emergency department, inpatient hospital, outpatient clinic, and surgical suite, I want to take a moment to recognize the heroism of my healthcare colleagues and friends who work the front lines every day to save lives, keep people healthy, especially in these trying times. These healthcare workers will be supporting us through this outbreak, and we want to make sure that we're supporting them. We want them to make the best possible choices to save the most number of people, to help everyone they can during this emergency. The governor's executive order to strengthen liability protections for doctors, nurses, and emergency medical care technicians will further our efforts to recruit personnel to staff existing facilities, this facility, and other alternate care sites, and help us save Arizonans. In addition, our agency is working with the chief medical officers from hospitals around the state to develop this scalable model, and we will issue an RFP to have our healthcare partners take the lead in managing these facilities to meet the demand. Many of you have asked what the demand looks like, and the answer is there's no reliable projection. These models are dynamic and ever-changing. They're fluid, they're based on the number of cases, testing availability, available resources, and the physical distancing measures that we know Arizonans are practicing. But public health has a responsibility to plan for the worst so that should demand increase, every Arizonan has access to quality care. To date in Arizona, there have been 3,018 cases of COVID-19 in all 15 counties of Arizona. And tragically, 89 Arizonans have lost their lives to this disease. And while these numbers are high and COVID-19 remains widespread in our communities, we are seeing some positive indicators. The numbers to date are lower than many external projections, and we continue to see proof that Arizonans are practicing physical distancing, with nationally renowned resources like the Unicast map of social distancing estimated to have decreased by 65 to 70%. Across the country, we continue to see a shortage of testing supplies, from swabs to reagents, and Arizona is no exception. To date, 37,178 tests have been administered in Arizona. That's more than a 3,800 test increase from the 33,000 total we provided in our briefing last Tuesday. And yesterday, we received all 15 of the Abbott testing machines allotted to the state. This includes materials to conduct 120 tests, and we have placed orders for over 1,600 more. These tests are in addition to the commercial lab testing that's available, as well as existing state lab resources. These machines, though, have the ability to detect whether a patient has COVID-19 in as little as 15 minutes. And they will be distributed around the state to rapidly test high-risk, vulnerable populations, such as those in nursing care institutions or other congregate settings. Due to the national supply shortage, we must continue to prioritize testing the most at-risk Arizonans and those on the front lines, our healthcare workers and our first responders. Remember that testing will not change your treatment, but it can provide certainty to those first responders and healthcare providers who continue to be in high demand as cases increase in Arizona. And as we continue to collect more data about COVID-19 in Arizona, we will continue to enhance the information that we'll be reporting on our website. So on Sunday, we'll be updating the data on our website to report additional information that was made available through the Enhanced Surveillance Advisory. So beginning around noon, the site will include the following information: race and ethnicity information on confirmed cases, location information of confirmed cases by zip code, and the ages and gender of COVID-related deaths. The site will also include the number of hospital beds and ICU beds available and the number of beds in use for COVID-19 treatment, and then data regarding hospitalizations and ED visits for COVID-related treatment. We will also be adding additional information to the website about the health of our healthcare system as we prepare for the increase in COVID-19 cases. We'll continue to update this website daily at 9, and we're working around the clock to increase additional reporting. Finally, we're pleased to announce that we received an additional $4.5 million from the Centers for Disease Control and Prevention to help our public health system respond to COVID-19. These dollars will go to support our state and our local public health departments. So I want to thank again the governor for prioritizing public health, the Arizona National Guard, and the Army Corps of Engineers for their support in this effort. And I want to thank my team for working around the clock in response to this outbreak. I want to remind everyone now more than ever, we must continue to stick together and remain connected. To that end, I encourage everyone to visit our new webpage, azdhs/mindfulness. This site is a result of our partnership with the ASU Center for Mindfulness, Compassion, and Resilience, and shares ways Arizonans can continue to support one another and practice mindfulness and self-compassion. I'm going to turn it over to Major General McGuire.
Good afternoon. Governor Ducey, thanks again for your great leadership, and Dr. Chris, great partnership, and to the Corps of Engineers, their hard efforts over the last nearly three weeks to generate plans for the state of Arizona to execute to meet the requirement or potential requirement for surge capacity in our medical system. I want to talk you through quickly how we got here, so that everybody understands the sequence of events and what we expect to happen over the next month. On the 21st of March, Governor Ducey authorized me to reach out to FEMA Region 9 through Mr. Bob Fenton, and it was granted by Mr. Peter Gaynor at the federal level, a request for a site survey team from South Pacific Division of the Corps of Engineers. Lieutenant General Semonite, the commander of U.S. Army Corps of Engineers, and Brigadier General Kim Colleton deployed a team under the lead of Colonel Fust. That team, since the 22nd of March, has evaluated 20 sites around the state. Those 20 sites are in 4 counties: Pima County, Pinal County, Maricopa County, and Coconino County. The first of those 20 sites that we're ready to action for refurbishment and reinstitution as a medical care facility at, as Dr. Chris said, a higher level of acuity is the site behind us here, the St. Luke's Medical Center. As I mentioned and has been mentioned, we hope this site is never needed, and our job here is to quickly help expedite the Corps of Engineers navigating all of the things that they need to in the local community to get this site up and running in the next 30 days. As we move forward with that, Dr. Chris' team has a great plan about sourcing, staffing, and equipping this facility, and the role of the National Guard in all of these endeavors is to gap any coverage that might be needed. Second topic, the discussion of the Navajo Nation that Governor Ducey mentioned, and I want to talk to you about how Team Arizona works together. This morning, Phoenix Fire informed our State Emergency Operations Center that they had some excess surgical gowns that were in great need on the tribal lands. This afternoon at 1:30, we launched a Black Hawk to send these surgical gowns to Tuba City and Kayenta, the areas of greatest need right now, as they treat our great partners on the tribal nation up in Tuba City. As we look at what we do in the enterprise, that's a great example of gap coverage, and surgical gowns actually is becoming a pretty challenging area for our healthcare providers, and as I've mentioned, these incident commanders at different hospitals around the state. Last night, Governor Ducey authorized us to send a KC-135 from Phoenix Sky Harbor out to North Carolina. That aircraft departed at 8 o'clock this morning. It's currently loading 40,000 yards of surgical gown fabric that will be sewn by local Arizonans to deliver to hospitals all around the state, and they'll be arriving back at 8 o'clock tonight at Sky Harbor. So I just want to tell you that we're there to meet the needs, to deliver the needs, and reassure all Arizonans that we have full faith and confidence in our healthcare system and the whole of community to solve this problem under the leadership of Governor Ducey. Thank you.
Thanks very much, Dr. Christ and Major General. Now I'd like to ask Damon to come up here and speak and tell us a bit about what's happening here at St. Luke's. Damon?
Thank you, Governor, and thank you for your leadership during this crisis. It's certainly been commendable, and we're all very grateful. I also want to thank Andy Tobin, Director of the Department of Administration, Dr. Kara Christ, Director of the Department of Health, and all the public officials and staff for their efforts. As a physician-led organization, Stewart Healthcare is focused on how to best serve the needs of the patients, the doctors, our first responders, EMS, and all healthcare workers during these unprecedented times. Our mission is to be a strong community partner in any way possible as the global COVID-19 pandemic continues to spread. In fact, it is incumbent upon all of us, healthcare leaders, elected officials, policymakers, private citizens, to meet the challenge for this moment and help Arizona plan and prepare for a storm we hope will never come, although we know it likely will. While we hope and pray for the patients are few, we must be prepared for all. For our part, Stewart is working closely with the governor and his team, along with the Army Corps of Engineers, on his plan to make St. Luke's Medical Center available for use by the state of Arizona. This is an opportunity to create additional beds and operating room capacity for the state of Arizona to care for more patients should the need arise. In addition, Stewart will be donating $1.5 million worth of medical equipment to the state so that the state's doctors and nurses have the necessary equipment to begin caring for patients. We will also lend the expertise of our facilities management staff at no cost to assist the Army Corps of Engineers as they open and operationalize the building. Stewart is doing these things out of our commitment to the people of Arizona because we believe we must meet this moment together. And while today we speak of buildings and equipment and supplies as our offerings to the common cause, let us remember the source of the greatest contributions. It's a dedicated commitment of our healthcare workers who are on the front lines of the battle of this disease. I want to acknowledge the extraordinary courage and selflessness of all of our doctors, nurses, and hospital staff who are putting their lives at risk every day to protect ours. They are the real story here today, and we are grateful for their heroism every day. Thank you, Governor.
Thank you, Damon, and again, thank you to Major General McGuire and Dr. Christ. We appreciate your leadership and your updates as well. With all the changes that we have daily with COVID-19, people often ask me, what's the main thing I need to know today? So my message is this: please keep doing what you're doing. The physical and social distancing, staying at home, staying healthy, washing your hands, covering your cough, following the guidance of the CDC. These efforts are working, we're seeing evidence, and they are paying off. So it's Easter weekend, and of course Passover as well. Our rural hospitals are especially hurting when it comes to available resources. We want you to be healthy. We want you to get outside as long as you can socially distance. But we're asking that you stay close to home and protect the rural medical resources to the largest extent possible. These next few weeks will be crucial, but I'm confident in Arizona's ability to rise to the test. I can tell you one thing, that Arizona will be prepared for what's coming. And with that, we'll take some questions.
Dennis? Yeah, today we got an update on the budget and the finances here in Arizona. More bad news has come after we found out that more than 250,000 jobs have been lost here. We're looking at now over $1 billion deficit. At the same time, we're seeing a surge in people who want state services like access. How are you going to pay for this? You cut your way out of this again? You know, last time we went through this, we had to sell the cow.
So the first thing I want to say is, of course, our focus is first and foremost on public health, but we're also thinking about the economy. Of course, our heart goes out to every Arizonan who's lost a job or had a reduction in pay. We see the numbers. They continue to soar. This is going to affect state finances. I would say that the good news is that Arizona planned ahead. Arizona has a rainy day fund. Arizona is in a strong financial position. So some of the announcements today are basically guesses. No one really knows because the economy is not operating. And without economic activity, it's very hard to make forecasts. So if there was good news, it was that Arizonans should know if they have lost their job or had a reduction in pay, there is a lifeline coming from the federal government. And that, combined with state resources, is going to provide a life raft for people to get through this. There are no needed cuts in state government today. Our teachers are being paid, our school workers are being paid without disruption, and our kids are at home distance learning. As we have a better sightline to what economic activity looks like, we'll have a better projection on what will be necessary. But like I said, before we come with any unneeded cut, we have money in the bank, we have money in the general fund, and of course, we have our rainy day fund.
Howie? Hi, Governor.
Hi, Howie.
Have you or your wife been tested for COVID-19?
No.
Why, given what your health director said yesterday to the Republic, why aren't you wearing a mask, both because you may be non-symptomatic or something else? And on one hand, your health director is saying, wear a mask. I don't even see her wearing a mask, which is the question for you next.
Well, CDC guidance is a mask is a recommendation. Of course, it's voluntary. How I've read the guidance is if people want to wear a mask, where they'd like people to wear a mask is if they're outside and they cannot socially distance. If I find myself in that situation, I'll be wearing a mask, and I have masks available.
Well, socially distant. You're in a DPS patrol car with other DPS officers who also aren't masked. It seems like somebody there is.
We have masks available.
Peter?
So, Governor Ducey, we're hearing from some sheriffs across the state that they're not so amenable to holding on to inmates in their jails instead of transporting them to state custody during the pandemic, as the DOC director has been saying. Are you aware of any discrepancies in messaging? What's your guidance from your office to sheriffs? How should this be handled?
So our guidance around the Department of Corrections and the transportation of inmates from jails to state prison is simply we will expect every official in Arizona to follow CDC guidance. There's a 26-page document on CDC guidance. It's available on the governor's website, azgovernor.gov. We're working with Director Shin of the Arizona Department of Corrections, Rehabilitation and Reentry, and he's coordinating with county sheriffs to apply to those documents. And the reason we adhere to the documents is we want to make sure that we're doing the proper placement of inmates so we can protect our population inside our jails and our prisons, of course, with care for our correctional officers and inmate population. So it requires us to take some time to cohort inmates over a 2-week period before transportation begins.
So you want to make sure that the inmates go where they belong, whichever system needs to hold them.
We would like to see the inmates go where they belong, and we also expect leaders to work together in a cooperative fashion and demonstrate needed flexibility so that we can protect the public.
Come over here to Dave. This question is for the governor and for Dr. Chris. Something we hear every day from our viewers is questions about the data and what's happening. So now just this week we reported that there are some 900 or 1,000 people who have recovered, and that's information that the state has, and I think the public would like to know that information. And then also that ASU is conducting some models themselves, and that's been given to the state. When can the public expect that information, and why don't they have it?
So I want to address some of this modeling, and I'll let Dr. Chris talk about what's happening inside the Department of Health Services. And I know there's often questions for projections or predictions or the models. And I want you to know these models change on a daily basis. They change on an hourly basis. Dr. Chris and her team look at a portfolio of different models. And just the guidance that we've gotten from the federal government, Dr. Deborah Birx and Anthony Fauci. I think we all remember the Sunday before last talking about an expectation of a possibility of deaths in the United States if we were all to exercise perfect social distancing would be anywhere from 240,000 to 100,000. Well, we've gotten additional guidance today where those numbers have been reduced down to 68,000. If you look at the model that Bill Gates refers to so often, the University of Washington model, the IMHE model that's available on the internet, their guidance, not only for the United States but for Arizona, has changed dramatically. And of course, we have a lot of very smart people at Arizona State University, University of Arizona, and University of Arizona Medical School that are putting together models. These are all things that we are looking at that are going into our thinking so that we can plan for a worst case scenario. So that's why you hear about so many different models, and that's why we're listening to smart people and learning and applying and changing in real time to protect Arizonans that could possibly be affected by this disease. Dr. Christ?
Thanks, Dave. So we will be posting additional data on our website starting on Sunday. We believe that the data that we'll have about hospitalizations and patients seen by the EDs and those types of data points will actually be better reported from the hospitals. Because I'm sure you saw the data that you pulled out of the line list from the website doesn't have complete reporting for hospitalization, so it had a lot of unknowns and a lot of blank entries. So we'll be posting that starting on Sunday. It won't be 100% complete because the hospitals are just going to start reporting tomorrow, that data.
Just one really quick
Yeah.
tiny follow-up. So we got some data that shows that there were, many recoveries. People want to know people are getting better.
Yeah.
Is that information that you will be willing to share now knowing that you have it? Because even if it's partial, I think people would take some comfort in knowing at least some number of how many people are recovered.
And we can definitely take a look. The definition's not great, but if it's something that will help calm anxiety, we're happy to take a look at it.
We have
Yeah.
a question back here. Go ahead.
What do you think of Dr. Rebecca Sunshine from Maricopa County coming out with her own projections versus the state not sharing projections?
Well, Dr. Rebecca is a public health official. We have 15 of them in the state of Arizona. Of course, Dr. Kara Christ is the one in charge of the state direction and guidance. But I applaud people in office that have an opinion or data-based information, and they have the courage to share it. It's up to leaders to learn, listen, and then make the best, most responsible decisions based on the facts and understanding that we don't have one county in the state of Arizona, we have 15.
To what extent do you take them into account, though, considering this is the most populated county in the state?
I take them into account. I mean, they are factored into the equation, of course.
Put a Zach here.
Governor, Dr. Chris, I know you mentioned 339 ICU beds here at St. Luke's. I know you mentioned 3 weeks as the projection. How are you planning on staffing this facility, and what's happening right now to make that happen?
So I want you to know, in terms of the surveillance, not only on the products, the inventory, the professionals, the personnel, that's something that we've got all hands on deck in terms of doing. Today in Arizona, we're in a position to do that, but the planning is around that worst case scenario, that potential surge where we'd be in a situation like we've seen in some other spots around the country. I'm going to let Dr. Chris talk about the specifics of how the plan would roll out and the role of the National Guard and assets outside of the state as well.
Thank you. So we will be issuing an RFP, a request for proposals, for our healthcare partners to come together and take over management of these alternative care sites. So there has been a very collaborative grouping of our healthcare systems, and it's been very promising. So that should be released either today or tomorrow, and then that will also be for the staffing, the resources, and the management of these buildings.
Are they going to be retired health professionals? Because you have to pull from active hospitals right now, and then you
So that's something that we're requesting in our proposal, our request for proposals, what they believe their staffing would be, what kind of help they would need from our registry of volunteers, what they would need from the National Guard, because we don't want to pull from those additional, our other hospitals who are currently treating.
Sounds like there's some unknowns in Arizona to be confident that this place is going to be fully staffed. Do we have the healthcare personnel to make it happen?
So we are working with the partners. We do have full confidence that it will be fully staffed. The healthcare systems have really come together to develop plans. So.
Dr. Chris, has there been any guidance to any doctors around the state about the use of chloroquine that the president has pushed?
I'm sorry, I'm afraid of bees. We have sent out a health alert network response on that, letting them know that because of potential shortages, they should use it judiciously, especially making sure that we maintain it for those people that need it for diseases like rheumatoid arthritis or lupus. And then it was addressed in the executive order.
Specifically for COVID-19 treatment, though?
Yes, in regards to COVID-19 treatment. We have not given guidance on using it to treat, but we have not prohibited it either.
Just to piggyback off Zach's question real quick, I've been contacted by a few retired nurses who say, I want to come back, I want to help right now. But the nurses board is saying I have to redo this, it takes 90 days. Have they been cleared to just jump back in, or what would you say to them?
We would recommend they go register on our website. It's ESAR-VIP. You can find it at azdhs.gov. We will work with the nursing board to identify if there needs to be any waivers. I know that they've been working on that as well as the medical board so that we can bring those retired physicians and nurses back into the fold.
Wrap it up, we have two more, Peter, then Howie.
So Dr. Chris, for you, talk about the validity of the test results and possible false positives that are coming from them. How much do you and your staffers trust the results of the COVID-19 tests that have come back?
The tests that the new ones or the ones that we perform?
The ones that you perform so far on an ongoing basis. We've had some medical professionals tell us they're surprised that the results didn't come back with COVID-19 for some of their patients that they thought had the symptoms of it. So we're just looking about validity and false positives in the mix and how you're accounting for all that.
So that would be a great question for my lab director who knows what the sensitivity and the specificity of that test are. PCR or RT-PCR tends to be pretty sensitive. So if you have the RNA or the DNA of the virus there, you usually will detect it. So we feel good when we get a positive.
What about the negative? Howie?
Governor, in your order today, you talked about providing a certain amount of immunity to people who come back. I know that Title 26 and Title 36 provide you with broad powers, but the Arizona Constitution in two specific places says you cannot provide immunity. So how do you get around the Constitution, which you don't have the statutory authority to do?
So I want to address this, and I want to say that the order is, this is to all our healthcare professionals, retired doctors and nurses that have been credentialed but are not currently practicing. I think we've all seen some of the inspirational stories that have happened in other parts of the country. I think 76,000 healthcare professionals stepped forward in New York to put on a gown and a mask to help when they were at the height of their crisis. We know that those same type of people live here in Arizona, and we wanted them to be able to come in and help as necessary. There is a provision that bad actors, of course, will be held accountable. And I'm confident that I get good legal counsel before we put an executive order out, that we not only have respect for the state and federal constitution, but that we're following the law.
Okay, real quick, and this is maybe a little more personal. Now that you've closed the barbershops, I know you're very proud of your hairdo. Are you going to finally let your hair grow out?
We're going to focus on public health. I appreciate the personal question.
We've got a few more to get to, but we're going to wrap it up. So Dennis, and then we'll come around.
Speaking of barbershops, I kind of want to go back to the beginning of the week, which was a long time ago, when you offered up that additional guidance for essential services out there. Now, we have gotten some calls, emails at our station from folks who say, like, look, if I'm a barber, if I make a house call, is that a violation?
So all of the orders that we've put forward have been for one reason, and it's been to attack COVID-19. It's to get all hands on deck to stop the spread of this, to lower it, to what they say is to flatten the curve, so that we have enough hospital beds and doctors available at the peak of the surge. My heart goes out to everyone who has lost their job or had their pay lowered. Especially, I mean, the barbers in our state are as hardworking as any Americans we have. Many of them work 6 or 7 days a week. Many of them are new Americans or first-generation immigrants. There are dollars available for them. Many of them have never taken anything from the government. Their jobs have been stopped by government order. So I would say to them, please access these benefits. You have earned them because of the government's decisions to protect public health. Around the other side of your question, the order is around places of business. That's what it's specifically about. It's not anything beyond that.
Said it was a class 1 misdemeanor, $2,500 fine. Are you guys checking back to see if that order of yours is being enforced? I would assume that you would want to make sure it's being enforced.
Oh, we're certain it's being enforced. You heard Dr. Chris's message in terms of how good and responsible Arizonans have been on their social distancing, and I want to thank them again for doing that. Not only are they protecting themselves, they're protecting their loved ones and neighbors that they don't even know and will never meet.
We're going to, Zach, wrap up.
Yeah, I think this question is probably best for Dr. Chris. Correct me if I misunderstood this, but I think you said yesterday you guys received 15 new COVID-19 test machines.
Yes.
And I just wanted you to explain that a little bit more. Where are those test machines coming from? Where are they going to be sent to the state? You said a 15-minute turnaround. Are they going to be drive-throughs? Where are people going to be able to access those? Just kind of explain to people who are curious about those because they may want to get tested quick.
So these are testing machines that have been deployed all around the country. So the federal government sent each state 15 testing machines, in addition to the initial small supply of test kits. So those came in. We are currently looking at working with our county health departments to get them deployed so that they can be utilized within the county where the county sees that they would be useful. And then also working with some of the tribes to see if they need them.
You know how quickly you'll have those dispersed, and will every county get one?
It will depend on, I don't know what the exact plan is just yet or when they're going to go out, but we're trying to get them out as quickly as possible.
Last question here with Matt.
Governor, I want to ask you about unemployment. I think one of your first executive orders got rid of the waiting week, but we've been contacted by a number of people who said that is still in place. They're waiting a long time to get this unemployment insurance. Are you disappointed with how that got rolled out? Was there too much stress in the system?
So one thing I want to say is yes, we did waive that waiting week. So if you are unemployed, you can apply for benefits, and we're going to have the benefits flowing as soon as possible. There's no waiting week. Now the discussion about was there too much stress put on the system? Let me just address that. The amount of folks that were on unemployment before COVID-19 hit was about 17,000. The first week's claims were 29,000. The second week's claims were 89,000. I think we're at 150,000. We're higher today in the first 3 weeks than we were at the height of the Great Depression. The Great Recession. The Great Recession was kind of a slow roll down a long rocky hill until we hit bottom. This was the economy falling off a cliff, and it has not yet hit bottom. So what we want is that the state is prepared with not only the state dollars but the federal dollars so that there's a safety net that's strong, that it's been stretched, and that can eventually become a trampoline to allow someone who's been unemployed to be re-engaged and to re-enter the workforce. Director Tom Betlak, who used to run Access, had actually retired from state government, was so good at what he did. We actually put out the Tom Betlach Award for the most valuable person serving in state government, has come back to run the Department of Economic Security. He's brought in reserve servers. They are hiring at the Department of Economic Security. Not only people to answer the phones, but to execute the checks, whether it's the paychecks into the bank accounts, direct deposit, or through the mail. This will result in $840 a week per Arizonan for 26 weeks plus an additional 13. It's going to be about the fourth week of April for that to be completely working. In the interim, there will be the $240 increments that will go out. That's our expectation, and we expect it to work.
You probably know this. The service industry has really been hit hard by this time. I was contacted by a couple of people in that industry. They have a lower minimum wage because they have tips. They claim their tips, but DES tells them they're not eligible for unemployment because of that lower minimum wage, that quarter threshold that they have to meet. Are they screwed? Are they free?
Well, I want to get some clarity on that, because it's my understanding that anyone that had employment, had a full-time job, or had compensation that was lost or lowered, the way I've been briefed and brought to understand the CARES Act, the $2 trillion in funding that has been put forward and already passed the United States Congress, has dollars in it for all of those people, including small business owners and medium businesses. So let me get some clarification on that. And let me close by saying, of course, it's Easter weekend. It's Passover as well. Tomorrow is Good Friday, which is a day of sacrifice and fasting. And I know that all Arizonans are feeling a sacrifice in COVID-19. As we continue to have new information and data, we'll continue to conduct these press gatherings. We want you to know what we know when we know it. We'll continuously update the website. The best place to go for health information is azhealth.gov. And if you are an Arizonan who's been displaced and is looking for the benefits that you want to access from both the state and federal government, and I encourage you to do that, please go to azdes.gov. And if you're in a position where your pay has not been interrupted, where you still have a job that is direct depositing into your account every 2 weeks, please go to ArizonaTogether.org and you can donate. There's a lot of people that need help. There's a lot of kids that need these hotspots. You make those contributions, we'll get that hotspot, and the family will be distance learning. I want to thank everybody for what they're doing, and I want to wish everyone a happy Easter. Thank you.